Hi, I'm Dr. Kate Owen. I'm one of the directors at the Queensland Institute of Family Therapy in Queensland, Australia. And this YouTube video today is going to talk about family therapy with individuals. So who is this for? If you are a counsellor, a therapist, a mental health worker, or anyone who's in the helping profession where you're working with people in a systemic way, then this YouTube video will help you to understand systemic practice principles about how to work with individuals in systemic ways, practical tips, and to reflect on your own clinical practice. Now, if you're wondering, what does systemic mean? Well, it means relationships. It means looking at the bigger picture, not just focusing on the individual, but the individual within their context embedded in relationships. There's a myth in family therapy that you need whole families in the room. And so when I'm running training, people will often say, but can I do family therapy if I only see individuals? And the answer is most definitely yes. Because when you work in a systemic way, it's about systemic thinking and systemic principles. And you can apply those principles and that way of thinking to working with individuals, dyads, families, groups, and even workplaces. And so this is what we mean by a system. So systemic family therapy is not about the number of people in the room. It is about how you as the professional view the presenting problem. It's how you think about change and how problems resolve. It's about the questions that you ask and where you focus your inquiry. And then it's about what you're targeting in treatment. If you enjoy this YouTube video, then on our website, qldfamilytherapy.com, we have a blog that goes along with this, as well as an infographic that you are able to download for free and to share. So let's get started. Let's talk about guiding principle number 1. Let's consider context. So the key concept here is that people are shaped and influenced by the context in which they live. So context can include era in time, culture, the immediate family system, also significant relationships outside of the family. So this might mean community. We can think about context in terms of geographical location, religious beliefs, what's going on in the broader society, and many, many other factors. When we're thinking context, we're thinking across time. So we're looking at what's happening in the here and the now, as well as the past. And so a systems thinker will be thinking about the multi-generational context. For example, if you have a client who presents to you and they have symptoms of anxiety, then the systems thinker will look at the broader context of that person's life across time. And through that systems lens, then the practitioner might discover that these symptoms of anxiety developed within the context of possibly a critical upbringing in childhood. The present context might be ongoing strained family relationships. It might also be the context outside of the family, so the workplace, dissatisfaction because of competitive colleagues or things that are going on in the workplace that's making the person feel anxious and unhappy. And it can also be about the future. So worrying about the future due to fertility challenges and wanting to be a parent and not knowing if that was going to happen. And so this is how you know if you're working systemically with an individual, because you're looking at their context, past, present, and looking into the future. And how is that contributing to the symptoms that they're presenting in the room with you? So here's a few practice tips. Curiosity. Hold curiosity about your client's context. Really maintain an interest in the bigger picture of their life. And in systemic family therapy, we talk about this as taking the helicopter view. So imagine that you're taking a helicopter ride up and you're looking down across time of the person's life and experiences. Another tip, a genogram. So a genogram, it's more than a family tree. It captures more than just who's who in the zoo. It's about relationships. It's about different patterns of functioning, and it's definitely across 3 generations. And so this is a great way to keep your systems hat on when you just have one person in the room, because by doing the genogram, it really helps to bring the family in, even if you've just got the individual in front of you. Another practice tip, chart a timeline. And so looking at the individual's journey through life, as well as the significant events and transitions of their family. And so you might do this in chronological order, picking a point in time, starting from when the person was born, or maybe when they started their family. Those would be things that you would decide with the person in front of you. Let's move to guiding principle number 2, viewing relationships as the client. So the key concept in systemic practice is that we're focusing on the relationships in a person's life, because we have this basic belief that the behavior of another is most likely relevant to what's maintaining the presenting problem, because it's all about relationships. So when we have our systems hat on, even if we only have one person in the room, we're thinking about the concept 1 + 1 = 3. Let me explain this. This means that there is an individual who might be having difficulties with another individual, and the systems thinker takes into account both of those people's positions or beliefs or thoughts or feelings or contribution to the situation, and it's about the relationship dynamic between the 2 people, and that's what we're interested in. That's the focus. And so we're looking at the relationship as the client. So here's a practice tip for you. When you're working with individuals, define the problem in relational terms. So it might be that it's around communication challenges. It may be that in a partnership, relationship, work context, family context, etc., that maybe there's poor conflict resolution skills that's happening. You might be interested in the quality of attachments. You might be looking at the family structure. Are there coalitions? Is there an inverted hierarchy? Maybe the problem is around family rules and the challenge of having those reinforced or appreciated or respected. Maybe it's around boundary challenges. So defining the problem in relational terms. Another tip to keep you on track to work systemically, even if you have one person in the room, is setting then relational goals. So for example, you could ask your clients this question: what would be different in your relationships after you have finished here? And what is the first small step to take to head in that direction? Perhaps you could ask, how would you like things to be different in your family? How will you contribute to that change? And another great question, what problem is most pressing in your life and relationships? And these questions will help you to set those relational goals, and that's going to keep you on track to knowing that you're working systemically, even if there's only one person in the room. Now, here's a little disclaimer for you. If your client feels strongly about a certain view of the problem, so for example, they're saying, no, I am depressed. And so they're really saying this is about me. Or they're saying, no, it's my partner's drug use. That's the problem. Then it's really important that the therapeutic relationship takes precedence. So what this means is that you, as the systemic practitioner, you explicitly accept the client's definition of the problem. And then as you work with them over time and you're building rapport and trust, you're exploring ways to be able to describe the presenting problem using relational terms to try and see if the client can start to take a holistic view of how these problems are being created or maintained. So let's go to the third guiding principle, having a triadic focus. So a family therapist views the presenting problem from what we call a triadic lens. This basically means that the family therapist recognizes that problems are interactional. In a lot of therapies, they might have what we call a monadic focus, where the focus is really on the individual and supporting the individual to create changes for themselves. For example, cognitive behavioral therapy, looking at the person's beliefs, their behaviors, and really focusing in and supporting that person. Some therapies are very dyadic. So, for example, looking at attachment between parents and children, and the focus of therapy is then on that one relationship. And so the triadic focus in systemic practice is looking at the bigger picture of where problems might be developing and also where you can intervene. Now, a triadic focus can mean more than just 3 relationships. Here's an example. So imagine that in your clinic, a child is presented as having a problem. And the problem is that the child is escalating in behavior when their mother is unable to meet their emotional needs. So it would make sense that you might think as a treatment idea, I'm going to coach the mum to attune to this child, and that's really going to decrease the child's symptoms. But what if, from a triadic lens, that the mum's emotional distance at that point in time with their child actually reflected her focus on the couple relationship because it's under emotional strain? And what if at that point in time that emotional strain and that emotional distancing was also related to the husband distancing from his wife because he was worried about financial pressures and challenges in the workplace? So I hope that this highlights a really great example of how the triadic focus, when we take the helicopter view, gives a greater understanding of what's contributing to the presenting problem, what's maintaining it, and what it does is opens up multiple treatment options because we can focus on the child, the mother-child relationship. We could focus on mum. We could focus on mum and dad's relationship. We could focus on dad's worry about work and what's going there. So we've actually now got lots of different options for where we can intervene. So a practice tip for you, if you're thinking, am I doing family therapy when I've only got one person in the room? Think in 2s, 3s, and more. So when your client describes a challenge that they're having with another person, then explore the interconnected and implicit relationships inherent in that dynamic. So for example, if a client says, I feel so angry, I don't get along with my partner and we are fighting all the time. So then the systemic practitioner would be curious about, so who do you turn to for support? What has changed recently that's contributing to these tensions? And what we want to do is make those explorations broader and wider so that we can see the bigger picture of what's going on. Another practice tip: appreciate that change and outcome and progress, etc., can come through any relationship. This is the beauty of the triadic focus. So this means that if we go back to the example before, with the child, the mum, the dad. When we have the triadic focus, then what we want to do is work with the most motivated person. And so that might be that one person that's sitting in front of you in your office. We want to empower that person to see that they can affect change because they are a part of the system. They are a part of the dynamic. It's also a great way for us as therapists and professionals and clinicians to be humble in appreciating that we as a therapist is one relationship that may contribute to change, but we may not be the most significant relationship as the catalyst for change. Let's go to guiding principle number 4, thinking in circles when you have just one person in the room. Linear explanations take the form of A causes B. Now, in most counseling studies, there's a strong focus on A leads to B, which leads to C, with the focus on just the individual. So, for example, when little Johnny sees his parents arguing, that's the activating event, A. He has negative thoughts, believing it's his fault that mum and dad are in conflict. So that's his belief system. There's B, which then leads to, in a linear fashion, leads to him becoming dysregulated. So then we have maybe some externalizing behavior. So that's C. So a linear focus is A leads to B, leads to C for this one person. So then the linear therapeutic approach is to support little Johnny with his thoughts, feelings, and his behavior. Now, linear thinking is not incorrect. From a systems point of view, however, it only punctuates one part of a larger whole. And so this circular perspective provides a more complete, holistic, and coherent perspective. So let's go through an example. So let's start at the top of the circle with the A. So a systems thinker would try and track how everything is connected. So let's say that the parents are worried about finances. They're really struggling. They're under the pump. And so that is leading to a lot of tension. So then what does that lead to? Well, it leads to them probably arguing, and they're probably bickering and doing this in front of little Johnny. So what does this then lead to? Well, it might lead to Johnny starting to worry about mum and dad. Maybe he's thinking, oh, this is really different. I haven't seen them argue like this before. Maybe he's thinking about, what does this mean? So what would that lead to? So maybe he gets worried. And he expresses that worry through dysregulated behavior, maybe through some externalizing behavior, not listening, etc. What would this lead to? Well, that would be really worrying for his parents because they would be very stressed by having to manage what's going on with him while also worried about everything else. So what would this lead to? Well, perhaps then the parents start to argue more, because now they've got increased tension in family life about a few different things going on. So what could this potentially lead to? So then they think the solution is, we need some help for our kid because we love our kid. So maybe we have to pay for some counseling, get some ideas about how to support him. And what is that going to lead to? Worry about money and finances. So this way of thinking in circles, you can do this even if you have one person in the room. You can map out the cycle or the circle or the dance, what we say in family therapy, so that the person who's in the room can see everything that's contributing to the problem. They can see their part of what's going on as well. And so here's your practice tip. Help your clients explore those patterns. Explore all the significant others involved in maintaining the problem. And when you're mapping out these sequences, then some things to hold in mind for you. What is the dance? What is the dynamic? What is the interaction? What's the pattern? Who is in the dance? There's going to be more than one person. Remember, triadic focus. And then what are the steps? Who does what? What happens next? So here are some great questions for you to map out sequences when you have a person in the room with you. Different questions like, who did what? When? What happened next? Who else was involved in this? What were you thinking at the time? What were they thinking at the time? What came after that? How did it end? And of course, you would ask these questions in whichever way fit in the moment working with your client. This is not a prescription. These are just some ideas for you to hold on to. Another practice tip. By thinking in circles, even when you only have one person in the room, the aim is to remove blame. We want to empower people to look at their part of the pattern that they can control, that they can influence, and that they can change. So when we explore circularity, it really creates an opportunity to discover which of the part of the dance can be changed. And if you only have one person in the room, they're going to be a part of that dance, and then they can choose and decide, and with your help, think about ways that they can do something different. Guiding principle number 5. Asking relational questions when you only have one person in the room. Curiosity and questions are the hallmark of systemic practice. And asking the right question is often the best intervention. And you know what? Asking the wrong question gives you information also. So when we're asking question, what it does is it provokes thought, contemplation, introduces a new understanding. And we call this news of difference. Because when we have that new understanding, when your client has that new understanding, it creates a new context, a new way of seeing the situation. And that has the potential to lead to change. When we understand something differently, we often approach the situation differently. Of course, a systemic therapist will ask intrapsychic questions and linear questions. Absolutely. So, for example, I'm always asking, what were you thinking when that happened? How did you feel? What are you most worried about? And also, the hallmark of systemic therapy is to ask questions that explores relationships. We're exploring interactions. We definitely want to be exploring context. We would love to explore different viewpoints. We're making meaning of the situation, and we're looking at collective strengths and much more as well. And by asking these relational questions, then we're really helping to move the client from a linear understanding to an interactional perspective. And we can do that even if there's only one person in the room. So it's a great way to bring the family or bring those other relationships into the session. Here's just a few examples. So you could ask, if your partner was here, what would they say is the problem? Who else would agree with your point of view? You could ask, who else would disagree with your point of view? Tracking some sequences. After you argue with your partner, what happens next? Who else gets involved? We could ask, how have you and your family gotten through difficult times in the past? And if we're using a narrative approach, how has the problem impacted on your friendships? So again, just a sample of how to ask relational questions when you're working just with the individual. So you know that you're still having your systemic hat on. Here's a practice tip for you. Invite the opinion of others who are not physically in the room. How do you do this? So we call this circular questioning. You invite your client to place themselves in another person's shoes or to think about a dynamic between other people. So inquire as to what the person would contribute to the discussion. You know, if your best friend was here today, what would they contribute to this discussion right now? We can ask about how other people would view the problem. We could ask if they would agree or disagree with the client, just more context, more understanding, the triadic focus. We could ask how that other person would make sense of the situation and what ideas would these other people have for resolving the problem. When you're inviting the opinion of others, not physically in the room, then it can be a creative experiment. You might ask about the person who's involved in the situation or the people involved in the situation and invite their opinion into the room. You can ask the person to reflect on a friend or an ally and what their thoughts would be. You can also ask the person to think of someone from their past who they hold in high regard. And that person may be still with them or they may have passed. Hold in mind cultural appropriateness around that type of questioning. You could ask the person to think of a great role model in their life and what would they say? How would they make sense of what's going on? Perhaps you want to ask about a celebrity and really tap into the people that your client looks up to and values, although they might not be actually connected to them. And for some people, it could be a loved pet. You know, what words of wisdom would your wonderful dog say about this situation? And as they're witnessing this in family life, because they're a part of family life, how would they make sense of what's going on? So I really encourage you to give this a go. Let's go to guiding principle number 6, monitoring your systemic alliance. So therapeutic alliance is one factor that really predicts the outcome and the progress in therapy. I can imagine that if you're a helping professional, you have tons of strategies, tons of ideas, tons of skills to know how to build alliance with clients. Hopefully, if you're a systemic practitioner, that you're holding in mind that we hold alliances with multiple people. This is really important, especially if you work just with individuals, because we still need to have those multiple alliances, holding them in mind, even if we only have that one person in the room with us. So this is a reflection for you, and you can pause this video and think about this if you like. Do you feel strongly aligned with the person in front of you because they're the one that turns up? They're the person in front of you. Do you engage with your client as if other family members were sitting in the room? And how do you hold the broader system in mind when you're working with just one person? Some interesting reflections might pop up. So here's a clinical practice tip. Your systemic alliance, when you just have one person in the room, engage with the client as if other family members were there, were watching, were listening. And that's really going to sort of keep you in check in terms of the way that you respond, the questions that you ask, and much more. Another practice tip, maybe keep the client's genogram close by as a reminder that your client is embedded in significant relationships. Consider using chairs to represent the missing family members in the room, but who are really important in the conversation. I hope you've enjoyed this YouTube video and the 6 guiding principles of knowing if you're doing systemic practice, even if you just work with individuals. Stay connected. You can join our monthly newsletter. We have lots of workshops. We also have an advanced certificate in systemic family therapy accredited program. So jump onto our website and check out all the resources that we have on offer.